Hello, this training is on psychotropic medications. What are psychotropic medications? These are used to treat mental health disorders. There are 5 main types of psychotropic medications, and each one has its own specific uses, benefits, and side effects. These 5 main types are antidepressants, anti-anxiety meds, stimulants, antipsychotics, and mood stabilizers. If you want to find specifics on a medication, the first thing you're going to do is go to the MAR in SetWorks. You're going to click on the name of the particular medication. You'll be redirected to a website called drugs.com, where you can read what the medication is, what it's for, and what the side effects are. So common side effects of psychotropic medications: drowsiness, dizziness, dry mouth, feeling tired, constipation, weight gain, trouble sleeping, restlessness, and these are just to name a few. Some important things to be aware of with psychotropic meds is something called extrapyramidal symptoms, also known as EPS. These are serious side effects that can appear after taking certain antipsychotic medications. They can affect motor control and coordination. EPS can take several forms, including something called tardive dyskinesia. Tardive dyskinesia causes uncontrollable facial movements. Things to notice and be aware of with tardive dyskinesia: facial grimacing, commonly involving the lower facial muscles. Finger movements like piano playing. Unusual movements with the jaw. Repetitive chewing movements. Tongue thrusting, so unusual movements with the tongue. Rapid eye blinking. So if you notice any of these unusual movements, be sure to document this in your notes and follow the chain of command with notification. You may be the first person to notice these unusual symptoms, and it's very important that it's caught early. Now let's talk about heat stroke. Psychotropic medications may impair the body's ability to regulate its own temperature. And during hot, humid weather, individuals taking these medications are at risk for developing excessive body temps and hyperthermia, which can be fatal. So prevention of heat-related illnesses: of course, try to stay cool. Avoid getting out during the hottest part of the day. Try to stay in air-conditioned buildings and homes. Stay hydrated. Always keep extra water with you on these hot, humid days. And some warning signs of heat exhaustion: so heavy sweating, paleness, muscle cramps, feeling very tired, weakness, dizziness or headache, nausea or vomiting, and possibly fainting. So treatment for heat exhaustion: you want to move to a cooler place as soon as possible. Give water if available. You want to avoid coffee or tea or anything that may be dehydrating. Rest. Take a cool shower or bath. Loosen clothing. Something more severe is something called a heat stroke. So this requires immediate medical attention. And warning signs of a heat stroke: severe pounding headache, confusion, no sweating, rapid heart rate, nausea or vomiting, and possible loss of consciousness. If a heat stroke is suspected, it is vital to take the following steps: call 911 immediately. Move the person to a cooler place. Use cold compresses to get their body temperature down. If left untreated, heat exhaustion and heat stroke could be fatal. So make sure you know the signs and symptoms of both, and if a heat stroke is suspected, call 911 immediately. Thank you.